Welcome to Nobleman Care Services orientation and annual training for direct care employees. Whether you are joining us for the first time or returning for your annual update, this training reinforces the essential knowledge you need to provide excellent, safe, and compliant home care. Our agency is committed to ensuring that every employee is fully equipped, physically, mentally, and professionally, to deliver compassionate and competent care in the home setting. Home care does not take place in a controlled clinical environment, which means your responsibility to follow safety standards and infection control procedures is greater than ever. Throughout this program, you will learn how to protect yourself and the individuals you care for through correct procedures, proper communication, and strict compliance with regulatory requirements. This training is based on federal OSHA standards, state guidelines, and Nobleman Care Services internal policies designed to support your success. Let's begin by reviewing foundational responsibilities within our organization. At Nobleman Care Services, the administrator plays a central role in maintaining a safe and compliant workplace. The administrator is responsible for developing, implementing, and annually reviewing the exposure control plan. This document outlines how the agency prevents exposure to blood-borne pathogens and what steps are taken when exposure occurs. The administrator ensures that all required protective equipment is available, including gloves, masks, gowns, face shields, and safety needles, and that engineering controls such as sharps containers are properly maintained. Additionally, they oversee the proper labeling of biohazard containers and ensure that spill kits and disinfectants are fully stocked. Their responsibilities include guaranteeing that employees are trained at the time of hire and annually thereafter, as required by OSHA. This training covers universal precautions, PPE use, respiratory etiquette, exposure incident reporting, and post-exposure follow-up procedures. The administrator also maintains all regulatory records, manages employee health documentation, monitors tuberculosis screening compliance, ensures hepatitis B vaccination access, and coordinates any required follow-up when an employee experiences a potential exposure event. By maintaining these systems, the administrator provides the backbone of our safety program and ensures that every worker has the tools they need to remain protected while providing exceptional care. Home care employees may face unique challenges because the delivery of care occurs in uncontrolled environments. OSHA requires that every employer identify which job roles may be exposed to blood-borne pathogens or other infectious materials. This is known as exposure determination. At Nobleman Care Services, roles at risk of exposure include registered nurses, licensed vocational nurses, certified nursing assistants, home health aides, personal care aides, companions, homemakers, physical therapists, occupational therapists, respiratory therapists, and any staff member providing in-home direct care. Potential exposure may occur through tasks such as wound care, blood glucose monitoring, assisting with toileting, performing catheter care, handling soiled linens, cleaning bodily fluid spills, or dealing with sharps such as needles or lancets. It is important to understand that exposure risk does not mean exposure is expected. It simply means that circumstances may arise where exposure is possible. For this reason, employees must use universal precautions at all times, even if they believe the risk is low. Exposure risk classification serves as a reminder that personal protective equipment is not optional, and every procedure involving bodily fluids must be approached with caution, consistency, and professionalism. Universal precautions are a cornerstone of infection control. This set of guidelines requires that all blood and bodily fluids be treated as if they are known to be infectious, regardless of the patient's diagnosis or medical history. This means that whether you are performing a routine procedure or assisting with personal care, you must assume there is a risk of exposure. Universal precautions protect both the caregiver and the client. Key components include proper hand hygiene before and after patient contact, wearing gloves when there is a possibility of contact with blood, mucous membranes, or open skin, using masks, goggles, or face shields during procedures that may generate splashes or droplets, and wearing gowns or aprons when contamination of clothing is possible. Universal precautions also prohibit certain activities in exposure risk areas: eating, drinking, applying makeup, or handling contact lenses are not allowed while performing tasks where exposure might occur. Even seemingly harmless actions such as chewing gum increase contamination risk and are therefore not permitted. Employees must also use proper cleaning and disinfection techniques. Equipment must be decontaminated before reuse, and single-use disposable items must never be reused. Contaminated surfaces should be cleaned using approved disinfectants that meet agency standards. Finally, waste contaminated with blood or other potentially infectious materials must be disposed of in designated biohazard containers. These containers must be closed, labeled, and handled with extreme caution. Universal precautions remove the guesswork, ensuring that every task is approached with safety in mind. Engineering controls are physical or mechanical systems designed to isolate hazards and reduce the risk of exposure. At Nobleman Care Services, these include Sharps disposal containers, safety-engineered needles, one-way valve resuscitation devices, and spill containment kits. Sharps containers must be puncture-resistant, leak-proof, and labeled with the biohazard symbol. They are strategically placed to allow for immediate disposal after use. A needle or sharp object should never be carried around, left on a table, placed in a pocket, or set aside to dispose of later. Immediate disposal is mandatory. Safety needles and lancets are designed to reduce the risk of accidental needle sticks. Employees must never attempt to disable safety features or manually recap needles. If a safety device malfunctions, report it immediately so it can be replaced. Hand antiseptics, antimicrobial soaps, and no-touch disposal systems help reduce cross-contamination. PPE stations provide gloves, masks, and goggles readily accessible at the point of care. Engineering controls work hand-in-hand with universal precautions, PPE use, and proper technique. By following these guidelines consistently, you significantly reduce the risk of infection for yourself and those you serve.